The Honorable Chief Minister, Sri Himanta Biswa Sarma, the Honorable Health Minister, Sri Keshav Mahanta. It's indeed an honor and a privilege to be here in Assam. Today is a very special day for us at the E-Governments Foundation and the 10BedICU project that you're here with us to launch this. And welcome to all the dignitaries on the stage, as well as many of you out here in the audience, as well as people out there on Zoom calls and YouTube broadcasts that's out there. You know, the question I keep getting asked since I was the CTO of the Aadhaar project during its founding is India's digital public infrastructure, which is the talk of the world today. And as the president of G20, India is talking about how to improve digital public infrastructure around the world. Often people ask me, how was Aadhaar designed for 1.3 billion people? How does UPI do 9 billion transactions a month? These are good questions, and India has actually figured out how to do this. And I'll share with you a little bit of this, because if we can bring that kind of scale to healthcare, especially in Assam, then we can transform the state from a healthcare perspective. Aadhaar itself not only enrolled 1.33 billion people, it has done 74 billion Aadhaar authentications to date. It has done 12 billion KYCs that helped people get bank accounts, get SIM cards, and so on. And we also linked it with bank accounts so that direct benefit transfers, $300 billion worth of direct benefit transfers went through. Which brings me to the next point on payments. UPI, Universal Payment Interface, did actually last month, it clocked a record 9.5 billion transactions in 1 month. We did $1 trillion of value moving through our payment systems, more than the United States, Europe, and China put together. Right? This is the impact of what these standard systems have done. So what is the magic that allows these to scale, and can we bring this to healthcare? There are two aspects: technology and standards. That's what drives large-scale projects with high-quality outcomes. So in this particular project, the 10BedICU project for critical care, we have looked at digital technology for medical devices. We have some of the state-of-the-art medical devices we'll talk about. The use of networks to connect hospitals, to connect doctors and nurses to patients in far-off remote areas. The use of data, analytics, and dashboards in order to make better decisions to improve outcomes. And of course, use of AI. We have a very interesting project I'll talk about in a minute about the use of GPT kind of generative technologies to improve healthcare. Coming to standards, standard implementation process across the state of Assam. As you would have seen, we have gone through a lockstep, one step at a time throughout the state on all the 23 districts. ICU equipment standards to ensure that whatever is launched in one hospital is exactly the same being launched everywhere, so that the training modules, the upkeep, the AMC, all of that is standardized, and we can keep a high level of standard delivery there. Standard ICU protocols on the clinical side. I see a lot of you in white coats, doctors and nurses. Standardizing ICU protocols, the famous book by Atul Gawande that talked about the checklist manifesto, the same approach here. Can we come up with protocols for standard diseases and types so that it helps us improve the quality of care, and so on. Data interoperability standards of HL7 and ICD codes and so on. So this is what we've done. So when you look at equipment, in fact, we imported equipment from Switzerland, Hamilton Medical, AI ventilators for adults, pediatric as well as neonatal, but more importantly, because it has an auto-weaning AI facility, even without a specialist, it can auto-wean the patient. Or the blood analysis equipment coming from Siemens, and so on. These are top quality equipment. This is not, the L1 equipment that we're talking about. And this is the standard that we offer in every hospital. Number two, the care technology platform. This is sort of the way we built Aadhaar, layered and modular, but more importantly, integrating with Ayushman Bharat digital mission. The health ID claims, in fact, we were talking about it. You have over 1.5 crores health IDs, ABA numbers. And today, can we integrate that? Those that have been created, the new ones that have to be created so that people get access easily. That's part of the project. HCX claim processing. Whether it's the Ayushman Bharat insurance or your own CM's insurance cover, which I heard is pretty good, Can that be integrated into the systems? That work is currently proceeding. The registries, ABDM registries of hospitals and nursing, all of that is part of this care technology. Today, care has been recognized by the United Nations as the 50th digital public good in the world, because it's not only being used in 9 states in India, but also many other countries. Next is data-based decision making. The Assam state dashboard we have built for this 10-bed ICU project basically allows data to come in from all the hospitals in a standard way in order to ensure that you can see in one place the number of admissions, whether it is by gender, by the age, by the different types of categories and so on, as well as you're seeing the active patient rate increase on the bottom, which is basically signifying that a large number of people are starting to use it, even though it has actually been launched only in about, being used in about 5 hospitals right now. After today's launch, it's going to open up to about 23 odd hospitals. But this is again based on standards and technology. This is dynamic data. Nobody is entering this. It is coming through our CARE electronic medical record package automatically from all across the state. And sir, I can tell you that this dashboard can be offered in your office so that you can also track the number of consultations, the number of patients, the lives saved in real time. Coming to clinical, we are standardizing ICU protocols so that the outcomes are improved for patients. Here is an example of septic shock protocol, which has been, we have today about 200 hospitals, a lot of doctors who are working with us from government, from private sector and so on. These standards help nurses and other doctors to look at it as a flow chart and actually administer care. If there is no specialist in the middle of the night and a nurse is seeing something really scary happening in front of her with a patient on, let's say, septic shock, she's able to look at this poster and try to figure out what to do next. So we are standardizing those ICU protocols across respiratory, liver, cardiac, renal, and other systemic functions, as you can see. This is just one example that I showed you. Training programs are super important. The Principal Secretary talked about it. Not just medical equipment training, basic critical care training, the BLS training, advanced life support, ACLS, as well as our software training is all part of the package. Again, standards that we follow. Here are some pictures from the training programs that we hold. Last but not least, so this is the most exciting development in the last few months. The Ayushma AI specialist is something that we have worked with Bombay IIT, with the Rizwan Quetta Center of Digital Health. And we are able to use GPT technology in order to answer questions by nurses. In case they don't have a specialist, they should be able to pick up their phone, go to our app, and ask a very specific question. In this case, and in our own language. It could be Hindi, it could be Assamese, it could be Bengali, whatever, and it should respond in that language accurately, without hallucination. That is what we set out to do, and it is happening. This is working. So for instance, in the case here, we are showing the nurse is saying, I've tried albumin, administers crystalloids, 3 liters, the BP still keeps going down, this person is suffering from septic shock, I think he's going to die, what should I do? I don't have a doctor here. And it is clearly saying you have to go to vasopressin, at this mg, it's giving drug dosing information accurately. Okay, so we are still under test, it is not yet live. Obviously, we have to test it thoroughly, but there is a lot of hope that this could help Assam if we can implement it. And we are trying to get Assamese support as well from a language perspective. So today, we have 3 clusters, as the Principal Secretary mentioned, and all these different hospitals, 23 districts that are covered here. So we are incredibly delighted that you're able to join and launch this program for us. And I'd like to take a minute on the donors. Mr. Vinod Khosla, who has probably joined us from California already on the Zoom link, he has funded this project. 80% of this project has been funded by him with respect to the hospitals and the tele-ICU hubs. And Vinod has been a huge pillar of support, not just from a funding perspective, but also from a technology connects and many other things that he's brought to us from the Silicon Valley. HDFC Bank, oh yeah, there we see it. So Vinod is right there on Zoom. It's quite late for him, probably in California, probably about 11 p.m. HDFC Bank Parivartan, the CSR arm of HDFC, they're also here present. They've funded the project for about 6 to 7 hospitals. So we thank them as well for helping us with this project. Google Cloud has been providing us functionality for the cloud functionality, and it has given us 1 free year of access to the Assam government. So we thank Google Cloud for that access. And last but not least, Hamilton, Mr. Schroeder is here from Hamilton in Switzerland, and they have donated 1 ventilator for every 2 that the project buys. So we thank Mr. Schroeder. Bob Hamilton is actually the CEO of Hamilton Medical, and he's also on the Zoom call from Nevada in the United States. So we want to thank all these donors, and we have a wonderful team of people. Bisoya Leutenbaum is here somewhere. She's been heading the project, our national program coordinator, and she not only, she started off as a regional coordinator in Northeast, and she's taken over as the national coordinator. We have Chandraban Kakoti, who's here somewhere. He's our state coordinator, and now he's been made the regional coordinator in Northeast. He's orchestrating the program from there. And as you can see, we have a lot of folks here from Northeast that are working very closely with your government. I will not go through this entire list of partners. It is E-Governments Foundation and Karuna Trust largely that's doing this program, several donors as you can see, and several partners including the Koita Center for Digital Health. And sir, today we are in 209 hospitals in 9 states, and we look forward to your active support to make this successful in Assam. Thank you so much.